Hi, how you guys doing out in quarantine? So this is going to be the last of my recorded lessons. Everything else is going to be assigned as homework because we're doing virtual stuff now. So this is chapter 12. We're going to talk healthcare ethics. Okay, so we're going to discuss the concept of ethics and its application to healthcare. We're going to define 4 basic models of healthcare provider behavior and apply the concept of stakeholder management to the healthcare industry and look at ethical dilemmas of organ transplants. Okay, so a few did you know. The concept of bioethics revolved as a result of Nazis' human experimentation in World War II prisoner camps. They were doing all kinds of experimentation on people without any kind of consent, and it was really awful. 18 people die daily waiting for an organ transplant. As the cost of the U.S. medical procedures has increased, medical tourism has become popular as more citizens travel overseas to have medical procedures performed because the procedures are less expensive overseas. Having like bariatric surgery is one of them. Having breast augmentation is another one. Anyway, workplace bullying is common in the healthcare industry also. So let's start with the intro. So legal standards are the minimal standard of action established for individuals in a society, as we looked at last week in healthcare law. The ethical standards are considered one level above the legal action because individuals make a choice based on what is the right thing to do, not what is required by law. So an action can be considered legal but not ethical. There are many definitions of ethics, but basically ethic is concerned with what are right and wrong choices as perceived by society and their individuals. So the concept of ethics is tightly woven throughout the healthcare industry and has been dated back to Hippocrates, the father of medicine in the 4th century BC, and involved into the Hippocratic Oath, which is a foundation for the ethical guideline for the patient treatment by physicians. To this day, physicians' actions have followed codes of ethics that demand the duty to treat. So being doing things, because you have the ability to, and so you have a duty to treat and to help others. So just for some historical perspective, here's the Hippocratic Oath in its original form. So it says, I swear by Apollo the healer, Asclepius, Hygelia, and Panacea, and I take to witness all the gods, all the goddesses, to keep according to my ability and my judgment the following oath and agreement, to consider dear to me as my parent him who taught me this art, to live in common with him, and if necessary to share my goods with him, to look upon his children as my own brothers, to teach them this art, and that by my teaching I will impart a knowledge of this art to my own sons and to my teachers' sons and to disciples bound by an indenture and oath according to the medical laws and no others. I will prescribe regimen for good of my patient according to my ability and my judgment and never do harm to anyone. I will give no deadly medicine to anyone if asked, nor suggest any such counsel, and similarly I will not give a woman a pessary to cause an abortion. But I will preserve the purity of my life and my arts. I will not cut for stone, even for patients in whom the disease is manifest. I will leave this operation to be performed by practitioners, specialists in this art. He's referring to surgeons. In every house where I come, I will enter only for the good of my patient, keeping myself far from all intentional ill-doing and all seduction, and especially from the pleasures of love with women or with men, be they free or slave. So no trading medical treatment for sex. All that may come to my knowledge in the exercise of my profession in the daily commerce with men, which ought not to be spread abroad, I will keep secret and will never reveal. It'll be HIPAA basically for us now. And if I keep these oaths faithfully, may I enjoy my life and practice of my art, respected by all humanity in all times. But if I swear from it or violate it, may the reverse be my life. There you go. There's the Hippocratic Oath. Okay, so let's talk about medical ethics and bioethics. So medical ethics focuses on the decisions healthcare providers make on the patient's medical treatment. Euthanasia or physician-assisted suicide would be an example of a medical ethic. Bioethics focuses on the field of study concerned with the ethical implications of certain biological and medical procedures and technologies. Organ transplant, genetic engineering are example of bioethics. Probably also the question whether or not to keep somebody on life support would be bioethics. And I want to talk to you just a minute about this is my cousin right here, his son, and their daughter. The daughter's name, so it's my cousin's granddaughter, and this is Celeste, and it's his daughter. Anyway, so as you can see, she's about 1 now. She has lost this foot, this hand. She just has nubs on this hand, and she doesn't have any toes on that foot. Okay, and she had some birth complications is what happened, and she was in a small hospital in Belgium, in a rural hospital in that area, and she was then transferred immediately. So part of it was, you know, they didn't detect anything earlier. Maybe they didn't test, maybe there was some neglect of care on that part of that hospital, and so she was without oxygen. She had all kinds of problems. They sent her to a big hospital, and they did everything they could to intervene, but in the process of her having, you know, problems with not having enough circulation and all of that, of course she lost a lot of, you know, some of her extremities. They all turned black and stuff, and, you know, rotted, had to cut off and stuff. And she, you know, we don't even know what the impact is on her brain, her development, and all that kind of stuff. We won't be able to see later on. So some of the arguments around in my family, you know, and there's people on both camps, of course, like always when ethics are involved. Some were like, it probably would have been kinder to let her die, because, you know, they saved her, yes, but now what kind of life is she going to have? And so these are the kinds of situations that medical ethics does come into play with. So first poll question for my class is, Celeste case of medical ethics or bioethics ones? What do you think? Okay, so healthcare ethical dilemmas. So ethical dilemmas in healthcare are situations that test a provider's belief in what a provider should do professionally. Ethical dilemmas are often in conflict between personal and professional ethics. And there's a lot of times there'll be conflict also between, like, different providers may think differently, and you may think differently than the patient, right? So a healthcare ethical dilemma is a problem, situation, or opportunity that requires an individual, such as a healthcare provider or organization like a hospital, to choose an action that could be unethical. Okay, so in class, we're going to play this little video. I'm going to link it below in the video. It's in your Nearpod. You need to watch this video. It's on the Charlie Gard case, in case you know what it is. And who do you think was acting in the best interest of the child in that case? Once you viewed the case, the parents or the hospital and the doctor. So let's talk a little bit about healthcare stakeholder. So the concept of stakeholder management is a relationship of organizations and all of their constituents, including shareholders, and how management recognizes the different expectations of each group. So the basic stakeholder relationship is in the healthcare industry is the relationship between the physician and the patient. And the pressure that stakeholders may impose on a manager can impact their ethical decision-making processes. So let's dive into the ethics of the doctor-patient relationship. So there are 4 models that I apply to this doctor-patient relationship. And a lot of times it depends on your upbringing and, you know, the way you approach life and stuff like that. So there's the engineering model. The provider empowers the patient with knowledge to make a decision. So the provider, the doctor, gives the patient all the information, all the knowledge they need to understand what's going on and to make a decision. Okay, that's the engineering model. The Priestley model assumes the doctor will make the best decision for the patient's health, and oftentimes then we just let the doctor decide, and the patient doesn't really participate. They just go along with it. The contractual model is based on a legal foundation, assumes there's an agreement between the two parties, and it assumes mutual goals. And then the collegial model assumes a trust between the patient and the doctor, and that the decision making is an equal effort. So there's a conversation going back and forth with a collegial model where questions are asked and maybe advice is sought, information is sought, and things back and forth, and then together come up with a plan or a decision. So here are the suggested ethical values of the doctor-patient relationship. So first one is autonomy. So decision-making may be different, and healthcare providers have to respect a patient's decisions even if they differ. So an example with autonomy would be a doctor's respect of a patient that maybe get diagnosed with stage 4 cancer and elects to not pursue any kind of treatment. So that would be giving a patient autonomy to make their own decisions. Beneficence, so the patient's best interest when making a decision is primary. So whenever a physician thinks about what is best to do, it's not always what may be the less costly, it's simply what is the best for the patient. Non-malfeasance, the healthcare provider will cause no harm when taking action. So again, you want to make sure you prescribe the right kind of medications. You're not going to prescribe medications that are going to make things worse, that you don't prescribe wrong types of treatment and all of that, where the patient can come to harm. Justice, the healthcare provider will make fair decisions. So this is especially trying to treat everybody fairly in a way where you're not going to decide one thing for one patient and then another patient is the exact same scenario going to decide something completely different based on gender, race, your own feelings towards the person, or whatever. And then dignity, patients should be treated with respect and dignity. So again, treating them as other human beings that have feelings, that have values, that have, that are worth something. Respect people, to treat them with dignity. Okay. So a decision-making model for healthcare dilemmas. So first, let's identify the dilemma. So in any given situation, there's going to be opposing views, but what are these opposing views about? So let's, we could pick, for example, physician-assisted suicide. So the dilemma is physician-assisted suicide. Is it a yes, no, like should it be legal, should it be illegal, whatever. Which we're in ethics here, we're again out of the legal realm, but to do it or not to do it. Okay. Then what are the conflicting ethics of each party? So for a physician, a conflicting ethic would be, but non-malfeasance. I'm not supposed to do harm to anyone, and technically if I'm inducing their death, then maybe I'm causing harm. It goes against my values and stuff. For the patient, they're conflicted because they're like, no, living with this condition is what's causing me harm. I want it to be done. Okay, so those are the conflicting ethics, for example, in that situation in each party. What are the alternatives to a solution? So, for example, for physician-assisted suicide, this is where the physician will administer the medication, the lethal medication. Then maybe an alternative would be euthanasia kind of thing, where simply the patient is provided with enough medication that if they took it all, they could just end their life. And then the decision is back on that patient, and it's really kind of out of the physician's hands and stuff like that. The identification of the impact of each alternative. So, one alternative, you don't do it, the patient keeps living and keeps suffering. But again, you did not harm the patient as a provider. And then the other alternative is, so the patient continues living in pain and stuff, or the patient commits maybe suicide, or the physician agrees, violates their ethical standards, and goes ahead and does the physician-assisted suicide or euthanasia type stuff, and the patient gets relief from their pain. So, and then you select a solution of those, like, depending on what y'all come to an agreement. The thing is, there's no absolute right or wrong on a lot of these things. So let's talk a little bit about ethics and research. So conducting research involving human subjects requires the assessment of the risks and benefits to human subjects, which then must be explained clearly to them before, to the subject before consent to participate is given. The principles of ethical research are outlined in institutional review boards. Any kind of research that's done in the United States, that research has to be approved by an institutional review board at whatever entity. So like here at ASU, at Arkansas State University, we have an institutional review board that has approved any kind of, all of the research that's going on, it has been submitted and approved by the IRB, okay? And so this is to protect human subjects so that we do not cause harm and do things that are unethical and often illegal now. So the IRB has the authority to approve, require modification to, or disapprove the research. So usually if it's well designed, it can approve it right away. Require modifications, they may see some problems that the researcher maybe did not anticipate and say, okay, if you change this, this, and this in your protocol, then we can approve it. And then of course the researcher then has a duty to change those things and then abide by that. And there's usually some checks and balances and stuff like that in place. Or if it's really poorly designed or it's going to harm patients, they can just say no. They can disapprove the research. So this group reviews serves an important role in protection of the rights and the welfare of human research subjects. Very, very important. So this video you need to watch, and this is on the Tuskegee experiment, and this is really at the basis of like why we need this. Sorry about that. And this has happened here in the U.S. So this is, you know, beyond Nazi Germany and stuff. So watch that video. And then I want you to think about this. Do you think that a pharmaceutical company that's doing clinical trials, for example, for a malaria drug in populations of tropical regions where malaria is present, and those patients would benefit from the drug, but these patients cannot read or understand a clinical trial research consent form, is that ethical? Right? So you can say, yes, it's ethical because they will benefit from the research. No, it is unethical because they cannot understand all the risk involved and cannot understand what is being done to them. All right, so some bioethical issues. So we're going to discuss various ones of these. So alternative reproductive methods are methods of conception that parents can use to have children, such as an in vitro fertilization, which means that the embryo is fertilized in a clinic using sperm from the father and the egg from the mother. And then you can have pre-implantation genetic diagnostic. This can be used to test the embryo for tissue compatibility with their siblings prior to being transplanted into the mother. And then it infers that this embryo later on, when it's a baby is born, could be used to help the siblings and stuff. There's also, just in the alternative reproductive stuff, you can even explore the whole topic of, okay, with in vitro. So you got, you know, mom's egg, dad's sperm, but, you know, what if mom can't produce eggs? You maybe have donor eggs. What if dad can't produce sperm? Maybe you have donor sperm. Maybe you have a donor egg, donor sperm. You can have donor egg, donor sperm, and a surrogate, you know, to carry the baby. So there's all kinds of ways the setup can work. So, but the idea of doing IVF just so that you can test the embryo for tissue compatibility for a sibling has its own gray area, because then if the sibling becomes ill, the designer baby can save the existing sibling's life by providing, let's say, bone marrow transplant. And if the embryo is not compatible, then it could be destroyed or simply not used or frozen, maybe donated. So this process is considered very controversial because many people consider their embryo, of course, early human life. And secondly, are physicians and parents playing God by determining whether the embryo should live or die, depending on if it's compatible with the siblings. It could be used to you know, save the siblings. Now, you can actually bank cord blood and bank embryos even if you have had IVF done. But one thing that a lot of people aren't aware of is that costs money. So that If you had embryos via, you had some IVF and some embryos left over, and you can store them to use later, but you have to pay to store them. If you give birth, they'll ask you, do you want to bank the baby's cord blood? It's going to be X amount of dollars per year. You can say yes, and of course then that means that only the people that have the means to do so can do that and potentially protect the other children by having access to that cord blood, or protect that child by having access to the cord blood, whereas a less fortunate mom that does not have the means to do it will not be able to do it. Okay, so next poll question. So you and your partner had IVF to have a child, and the procedure worked. They often implant several embryos at once, hoping that one or two will take. You now have twins. As a result of the procedure, there are 3 more embryos that are kept frozen. What should be the fate of these embryos? I'm going to give you choices that are very real choices. So you and your partner go for round 2 and use the rest of the embryos. Maybe you end up with 2 or 3 more kids. Yay. Or you put the embryos up for adoption through a snowflake agency. So maybe other couples that have tried IVF and it didn't work, or maybe homosexual couple, they could adopt an already created embryo that could be implanted in a surrogate or in a mom. So you donate embryos to research is another one. So to be used for embryonic stem cell research and vaccine development, or you choose to have the embryos thawed and discarded. So what would be the fate of the embryo ideally in that situation? So all human beings possess stem cells, which are starter cells for the development of body tissues that have yet to be formed into specialized tissue for certain parts of the body. For example, in your bone marrow, there's a bunch of stem cells that are going to become blood cells and stuff, right? The term cloning applies to any procedure that creates a genetic replica of a cell or an organism. Okay, so there are 2 major types of cloning: reproductive cloning, which creates cloned babies, and therapeutic or research cloning, which uses the same process, but the focus is replicating sources for stem cells to replace damaged tissue. So you could clone bone marrow stem cell, and then all you do is you can use it to replete a bone marrow. Okay. There are several ethical issues regarding cloning. So researchers worldwide have attempted human cloning with no success. Some feel that cloning humans is unnatural and playing God rather than allowing procreation to progress naturally. Genetic testing is another bioethical issue. It is carried out on a population based on age, gender, and other risk factors to determine if they're at risk for a serious genetic disease, or if they have a carrier gene that they may pass on to the children. So, for example, if you carry the cystic fibrosis gene or the sickle cell gene. If employers were aware of this information, could they use it to discriminate against employees? Would parents decide against having children because of the results of a genetic test? How accurate are these genetic tests anyway? And there are no regulations regarding the genetic tests, so individuals and families may make decisions based on faulty laboratory tests. And this is a very real problem. So here's a quick little video on, again, genetic testing and interpretation and stuff like that to watch. And then answer this poll. Would you want to know, while you are young and healthy, if you have genes to predispose you for certain diseases such as Alzheimer's or breast cancer? Yes or no? And you can think of it as other diseases too. Okay, so continuing with the bioethical issues. So then we have end-of-life issues of a patient can be an ethical challenge also. Again, healthcare providers may find this difficult to understand because they have been trained to save lives. The term euthanasia is a term most often associated with end-of-life issues. There are 2 major types of euthanasia: voluntary and non-voluntary euthanasia. Voluntary euthanasia is assisting a patient with ending his or her life at the patient's request. Non-voluntary euthanasia means the ending of the life of an incompetent patient, can't make a decision for themselves, usually at the request of a family member. Could be injection, could be taking pills and stuff like that. Confusion over the difference between euthanasia and physician-assisted suicide is another issue. So on top of the issues of whether to or not to do this. So physician-assisted suicide refers to the physician providing the means for death, most often with a prescription. The patient, non-physician, then ultimately administers a lethal injection. With euthanasia, generally means that the physician would act directly, for instance, by giving it a lethal injection to end a patient's life. So again, I get those two confused. I probably got them confused earlier. So euthanasia, the physician ends a patient's life. Physician-assisted suicide, the physician simply gives them that prescription, and then the patient themselves will end their life. Sorry if I got confused on that. Although euthanasia is illegal in all states except Oregon, where it was passed in 1994, Washington was passed in 2008, and Vermont, where it was passed in 2013, in California in 2017. It is, again, important to examine these end-of-life issues. So the Oregon Death with Dignity Act was passed in 94, it became effective in 97, and between 98 and 2013, written prescriptions increased annually at 12%. During 2014 to 2015, the average annual rate doubled to 24%, and during 2015, the death rate was 38.6 Death with Dignity Act deaths per 10,000 total deaths. The Washington mandate, which is effective in 2009, was modeled after the Oregon law. Similar to the Oregon results, more terminal prescription each year were requested. And as of June 30, 2017, 29 residents used the law to hasten their death. A survey of terminal patients showed they requested prescriptions because they felt they were becoming a burden on their families. So that's kind of crazy because families may not feel that way about it. And they were losing their independence, and they were losing their ability to enjoy life. Okay, so do you think voluntary euthanasia is ethical, and could you carry out that wish for somebody you love? So either yes, you think it's ethical, no, you think it's not, and then second part, either yes, and you could do it, or yes, but you couldn't do it. No, but you would follow their wishes, and no, but you cannot do it for them. So which one do you think? We'll just see where the class lands. A little bit on advanced directives. So advanced directives are legal documents that patients give to providers to ensure that if they're terminally ill and incompetent to make a decision, certain measures will not be taken to prolong the patient's life. So example of those measures would be resuscitation if the patient stops breathing, being placed on breathing machines or feeding tubes, or organ and tissue donations and things like that. So advanced directives should contain things about all of that. A lot of times they may sometimes be called DNR orders, do not resuscitate orders. My husband said a lot of times they put ANDs, all natural death, meaning just let them go. Anyway, so advanced directives is you giving your wishes about what you want done for yourself should that decision need to be taken. All right, transplantation is the general procedure of implanting a functional organ from one person to another. There are two major ethical and legal issues that are associated with organ transplants between humans. The decision-making process for who gets the organ, and financial remuneration from selling organs, so being paid for your organs, which then has resulted, for example, in the black market for buying organs. So since 1984, as a result of the passage of the National Organ Transplant Act, it is illegal in the United States to buy and sell organs, which has resulted in 6,500 or 6,500 Americans dying annually because of the lack of available organs. There is also an international black market for selling needed organs, which is kind of crazy. There's a continued increase in donors over the decades. In 2019, 113,733 were on the waiting list for organs. Of those, nearly 95,000 were waiting for a kidney. 21 individuals died daily waiting for a transplant. Ethical questions when making the decision as to who receives the organ. So is it just, how do you, basically how do you get to the top of the list? Is it need-based? Is it quality of life based? Like what are the criteria, and who gets to decide, on top of course of tissue compatibility. So in the United States, there is an organ waiting list. Should a sickest recipient waiting on the organ list receive the organ, or should the patient who may live longer receive the organ, right? So most need, longest use, how do we decide? So under the current UNOS, the patients awaiting a transplant are assigned a priority based on medical need. If a patient is waiting for a heart transplant, the patient who is on life support or is in intensive care will have first priority. Kidneys are allocated based on a point system maintained by UNOS, and liver transplant also include guidelines on alcohol abuse, which often destroys livers. So can't get it if you're an alcoholic. Depending on the state, individuals may enroll in a program that gives permission for organ harvest if they die, alleviating the pressure on families to make that decision to harvest the organs. However, in some states, permission is required by the family, which then, of course, places pressure on them. Only 40% to 60% of U.S. families consent to organ harvesting. Because the media has sensationalized the illegal buying and selling of organs and the unscrupulous behavior of physicians who are selling body parts for greed, then families now are reluctant to grant permission. So this video is inside the organ donation process, worth watching. So in other parts of the world, countries use presumed consent, which means that if the parent does not actively oppose the transplantation, then the procedure automatically occurs. So basically, you're automatically a donor unless you opt out, which is different than the United States. In the United States, consent must be actively received from the family first. Is it an ethical policy to assume the family will consent to an organ donation? Oftentimes the family is frozen with grief and cannot make a coherent decision. So is this policy then ethical to them? It is a really hard decision to make when you're going through it. So is it ethical to have a policy that assumes consent for organ donation? Organ transplants may occur between two family members because it has been determined that the compatibility is really high between family members, which would result in less risk of an organ to be rejected. The ethical issue with the situation is the pressure a family member will feel from the other family members to agree to give one of the organs to another family member, meaning basically if they say no, which they should have the right to say no, then they might be like ostracized from the family for refusing to help their brother or sister. And then living donor organ transplants is the only field of medicine in which two individuals are ultimately involved. So the patient donating the organ and the patient receiving the organ. So there are some things. So for example, you have two kidneys, you can donate one of them. So you would be a living donor and still live, right? And so in the United States, there's 19 states that offer a tax incentive to donate organs or marrow. Is that ethical? So yeah, if you donate bone marrow, you would be a living donor, again, for the marrow. Is this ethical? So having a tax incentive to donate bone marrow or to donate a kidney, is that legal? Because then does it affect the decision? If the donation ends the life of the donor, so for example, donor's been on life support or whatever, they're not expected to make it, they've been declared brain dead after so many tests, and when they're a donor, let's say the families agree to this and all of that, and so basically they keep them alive until they go to harvest organs, and then of course when you remove the heart and lung, then the patient dies because you can't live without those things. And so essentially the harvesting process ends the life of the donor. Is that ethical? Okay, so is it ethical to offer a tax incentive to organ or marrow donors? So as a result of the increasing need for organs, then of course there's the black market, which is an illegal form of commerce, and it has developed for the buying and selling of organs. The WHO indicates that there are 10,000 illegal organ purchases worldwide every year, which is again a conservative estimate. And then there's the procurement of body parts from poor people is illegal in most countries in the world. Is certainly unethical. So you're taking advantage of their need for money for them to coerce them into donating an organ. But nothing has been done because many of the organs recipients need these organs to live, and those individuals that sell the organ are making an informed choice. So for example, you could sell a kidney for a ton of cash. Another type of transplantation is what we call xenotransplantation, which is the transfer of organs from one species to another. Pig is often used. And so this has evolved because of the shortage of human organs available. Although xenotransplantation has been promising, then you have the ethical dilemma that we are killing animals for these procedures, which of course are only still experimental. So is there a difference between killing animals for food and killing them for organ transplant? Again, another ethical dilemma. Then a few other ethical issues. The concept of medical tourism or medical value travel has evolved because the U.S. healthcare services can be very expensive. Do U.S. health and global health administrators collaborate with insurance companies to arrange for U.S. residents to obtain medical treatment in India? United Group Programs offers living and decreased organ donor transplants from deceased organ donor transplants from foreign countries. U.S. organ transplants can cost $100,000 but are considerably less expensive overseas. Is this ethical also? So again, this chapter discusses a lot of several ethical issues that involve the healthcare industry and its stakeholders. Two components of ethics in healthcare are medical ethics, which focus on the treatment of the patient, bioethics, which focuses on the technology and how it is used in healthcare. Ethics can be interpreted differently by each individual. The facts presented in this chapter, again, can prompt discussions about different ethical perceptions for individuals with regards to the healthcare issues that are presented. And let me know if you have any kind of question. Again, of all the things to remember, just respect and dignity for your patient. Like, even if you do not agree with their decisions and stuff like that, respect them, respect the other human being. So that is it for this lesson on ethics. Thank you.